I am Migena. We'll discuss today about seroprevalence of herpes simplex virus type 1 and 2 in Albania, an 8-year study. The herpes virus belongs to the Herpes viridae family, which includes 8 types subdivided in 3 groups, alpha, beta, and gamma. In the alpha group, also known as the alpha herpes viridae subfamily, are herpes simplex virus 1, herpes simplex virus 2, and varicella zoster virus. The herpes simplex virus is an enveloped DNA virus. Its infection begins with lesions in the skin or mucosa, and replication in epithelial cells subsequently in the autonomic nerves, and finally it loads in the neuronal ganglia, where it remains latent. There is a scientific evidence that herpes simplex virus 1 mostly causes primary infections, while herpes simplex virus 2 infections are mostly recurrent and cause genital herpes. It has been hypothesized that approximately 1/3 of the world's population has experienced symptomatic herpes virus 1 at the same point through his or her lifetime. An oral herpes infection causes cold sores on your lips and around your mouth. Some people develop herpes gingivostomatitis when they first get infected. A genital herpes infection causes sores in your genital area, including the parts that you can see on those you can't see. Due to herpes simplex virus infections, various complications can occur, such as encephalitis, keratitis, or more organs in your chest and belly can be affected from herpes simplex virus, including your esophagus, lungs, and liver. These types of infections are more likely to affect people who are immunocompromised. Herpes simplex virus 2 remains one of the most common sexually transmitted infections, but continues to be underestimated, given the vague presentation of its symptoms. Herpes simplex virus 2 is transmitted through direct contact with secretions in a seropositive individual who is actively shedding the virus. The virus preferentially affects the skin and mucous membranes, invading epithelial cells in initial exposure and ultimately replicating intracellularly at that site. After the initial exposure and symptoms are resolved, in 10 to 14 days on average, the virus then lays dormant in the perioxynal sheath of the sensory nerves of either the trigeminal, cervical, lumbosacral, or autonomic ganglia. Antibodies to herpes simplex virus 2 are often present by the time of puberty, and their presence often correlates with the degree of sexual activity of that individual. More women than men have been reported to be infected, and as expected, the prevalence increases with an increasing number of sexual partners. From 2017 to 2024, there have been 10,953 specimens of humans suspected of herpes infection from the physician are collected and tested in Intermedica, a private laboratory in capital of Albania. Blood was collected and then centrifugated for 10 minutes. In recent years, there has been an increase in fertility problems, not only in couples who are of certain age, but also in young couples. One of the leading causes of infertility problems is sexual transmitted infection. Sexual transmitted infections in most cases are asymptomatic, causing harm without being understood here, and the determination of immunological situation of some sexual transmitted infections such as herpes simplex 1 and 2, syphilis, cytomegalovirus, Mycoplasma hominis, and Uroplasma oraliticum. In combating sexual transmitted infection, it is of great importance to detect them as quickly as possible, in the most efficient way possible, and with a procedure as easy as possible for the person undergoing detection. The first word in solving these problems is mark-based immunological test used in diagnostic. Immunological tests with markers make it possible to quickly measure very small amounts of antigens and antibodies by revolutionizing the diagnosis, monitoring a range of disease, leading to their rapid treatment. In this study, 10,953 serums were analyzed for the presence or absence of specific IgG and IgM antibodies. Serum testing was performed through the most efficient immunologic methods, herpes 1 and 2 IgG via electrochemiluminescence method, and herpes simplex virus 1 and 2 IgM via Serion ELISA Classic method sandwich principle. All the people can be affected by the herpes simplex virus. The high prevalence of herpes simplex virus positivity among individuals aged 21 and 30 years and 31 to 40 years can be explained by several key factors such as increased exposure and social behavior. People in 21 to 40 age range are typically more socially active, increasing the likelihood of herpes simplex virus exposure through close personal and intimate contact. Research suggests that herpes simplex virus transmission is most common in sexually active adults, especially those in their 20s and 30s. Many people contract herpes simplex virus 1 through oral contact and herpes simplex virus 2 through sexual contact in these age groups, so young adults are more likely to undergo routine sexual transmitted infection screening, which increases the detection rate of herpes simplex virus. People in their 20s and 30s are more health conscious and may proactively seek testing after potential exposures. This is also the age range where individuals tend to have multiple partners compared to older age groups, which increases transmission risk. Children are commonly infected with herpes simplex virus 1 through non-sexual contact, such as kissing, shared items, and exposure from caregivers. Newborns can acquire herpes simplex virus 2 during birth of the mother has an active infection. The lowest number of herpes simplex virus cases in the 71 to 90 age group is due to reduced exposure, fewer new sexual partners, underdiagnosis, and immune system adaptation over time. The data from 2017 to 2024 shows a steady increase in herpes simplex virus positivity, particularly for herpes simplex virus 1 and herpes simplex virus 2 IgG, which indicated past infection. This rise can be attributed to multiple factors, including increased awareness, improved diagnostic methods, and changing social behaviors. From 2017 to 2019, we have a gradual increase. The rise in positive cases during this year suggests improved testing availability and increased public awareness about herpes simplex virus. Humans have higher recorded herpes simplex virus positivity rates than men due to biological behavior and healthcare seeking differences. The higher number of females testing positivity for herpes simplex virus 1 and herpes simplex virus 2 compared to males can be explained by several key factors. Humans are more biologically vulnerable to herpes simplex virus infection due to the larger surface area of mucosal tissue in the genital tract, which makes virus transmission easier. Studies shows that male-to-female transmission of herpes simplex virus 2 is more efficient than female-to-male transmission. Women are more likely to seek regular sexual transmitted infection testing during routine gynecologic exams, pregnancy checkups, or contraception consultation. Men often avoid sexual transmitted infection testing unless they have symptoms, leading to more undetected cases in males. In many cases, when a woman is diagnosed with herpes simplex virus, her partner who may be asymptomatic does not get tested, and for these reasons we have an artificially high number of reported female cases because male partners may carry the virus but remain untested. Women may feel more responsible for reproductive and sexual health and are more likely to seek medical advice, leading to higher positivity rates. Men, on the other hand, may avoid sexual transmitted infection clinics due to stigma, embarrassment, or lack of the symptoms. The increase in herpes simplex virus infection positivity from 2017 to 2024 is driven by expanding testing, increasing awareness, and external societal factors. While the data indicates a rise in cases, it is largely due to higher detection rates rather than an uncontrolled outbreak. This data reveals a steady increase in herpes simplex virus positivity, particularly in herpes simplex virus 1 IgM. Over time, more people may have been tested due to greater awareness of herpes and sexual transmitted infection. Improved diagnostic methods and wider availability of tests had contributed to detect more positive cases. From 2017 to 2019, we have a gradually increased rise in positivity cases during this year, suggested improved testing availability and increased public awareness about herpes simplex virus. Also, from 2020 to 2022, we have a sharp increase in positivity rates. A notable increase in herpes simplex virus cases during this year suggests that external factors such as COVID-19 pandemic may have influenced transmission. Changes in social behavior like stress, lockdowns, and altered relationships dynamics may have affected transmission rates. More people resumed routine sexual transmitted testing after disruptions in 2020-2021. And from 2023 to 2024, we have continued high positivity. The ongoing rise suggests that herpes simplex virus is becoming more commonly diagnosed, possibly due to improved testing protocols and greater public health awareness. Also, urbanization and population growth contribute to higher transmission rates. Medical professionals are increasingly recommending routine herpes simplex virus testing, leading to higher detection rates. And conclusion, starting from 396 samples in 2017, the number of tests has increased significantly, except for 2019 due to COVID-19 pandemic restrictions, and reaching 2,403 patients in 2024. Many people carry herpes simplex virus without symptoms, but can still transmit the virus. Urbanization and population density increase transmission rates. Public health initiatives encourage early testing and awareness. The increase in herpes simplex virus positivity from 2017 to 2024 is driven by expanded testing, increased awareness, and external social factors such as COVID-19 pandemic. The 21 to 40 age group is at the highest risk for herpes virus exposure due to increased social interactions, higher sexual activity, and routine sexual transmitted infection screening. Encouraging safe practices, regular testing, and awareness can help manage and prevent infection in these age groups. The lowest number of herpes simplex virus cases in 70 to 90 age group is due to reduced exposure, fewer new sexual partners, underdiagnostic, and immune system adaptation over time. Women have a higher recorded herpes simplex virus positivity rates than men due to biological, behavior, and healthcare seeking differences. The higher Herpes simplex virus positivity rate in human is a result of biological susceptibility, healthcare seeking behavior, partner transmission dynamics, and routine pregnancy screening. Encouraging more frequent herpes simplex virus testing among men could help balance the detection rates and provide a clear picture of infection distribution. The rise in herpes simplex virus positivity from 2017 to 2024 is likely due to a combination of increased testing, better detection methods, and changing social behaviors. While the pandemic may have temporarily influenced trends, the consistent increase suggests that herpes simplex virus remains a widespread infection. Public health efforts should focus on awareness, early diagnosis, and preventive measure to manage transmission rates effectively. This is my presentation. I hope that it will be helpful. Thank you for your attention.